Welcome back. September is Suicide Prevention Month, so today we have Shakara Sneed, who is part of the Mercy Health Suicide Prevention Program, with us to talk more about the help that is out there. Shakara, thank you so much for coming here today. A lot of people have poor mental health right now. A lot of things to blame. COVID, a lot of issues, pressures, the economy, just a lot of different things. But let's from your own perspective, when should a person who's watching this interview think, you know, maybe I should see somebody because I'm kind of having some thoughts that I shouldn't be having. It's just not healthy.
Yes, so there's different signs that people definitely can be aware of. So it's a little different from youth and adults. Some of them are shared warning signs, but definitely if they're starting to feel maybe withdrawn from their social connections, or if they're going through like some kind of emotional pain, or if they're even talking about making plans for suicide, they definitely want to reach out to someone.
Well, and that's, if it's you that's the one having these issues, you're probably not going to be aware of the issues because sometimes that rabbit hole is easy to go into until you get down into it. So, yeah, okay, so if you're a family member or a friend, and you may be looking out for some signs from a friend or family member who may be, so you say, withdrawing. What other things you can talk about with that?
So if you're, like I said, if you're withdrawing from those, or even for adults, if they feel like they're starting to be a burden to others, or they might start saying certain things, like they might say, if this doesn't happen, then I'm going to do this, or if I feeling just depressed or I want to kill myself, they may just come straight out and say that. But there's behavior clues as well, so maybe if they are experiencing something from a past, if they lost a family member to suicide, they're definitely going to be at a higher risk as well.
But if the person is talking about maybe taking their life, is that a sign maybe that they're reaching out for help? Because there's a lot of times people will kill themselves and not talk to anyone about it. Like, we never saw that coming, because they just withdraw and don't verbalize their intentions at all. So how do you read that?
So some people will make plans, some people will be verbal about it, but some people will give you those different clues that you have to kind of just recognize those. So we do trainings that we offer to the community, so that way people can know when to ask those questions and how to ask that question and the right way, because there is a wrong and a right way to ask those questions. So just making people aware of those different things and those warning signs and clues.
So let's say you got the warning signs. What should, as a loved one or a friend, do to this person to try to lean them toward getting some help when maybe they would want to get help?
Yeah, so they can definitely reach out to some of the services here in Toledo, like 988, that's the crisis line. They can have them call them, or there's some other services in Toledo as well, like NAMI. They can reach out to Harbor, Zeph, or even if they have a therapist already that they see, so maybe they might have to talk to a doctor and see if they can get in that way too.
Are these programs expensive, or does insurance cover them if you're worried about getting the help but not sure you can pay for it?
Yes, some do take insurance, some are Medicaid, some of them are absolutely free. They just have to call like 988, just call that number, 988, and then they will connect you to someone to connect you to another resource.
Shakara, I've talked to many organizations and people regarding this very subject, and there's no question that it's more visible now. It is worse than it was, thanks to COVID and a lot of other things that happened with that. But also, people are just like more willing to talk about it now. It's out there. It's no longer a shameful thing. How has that changed from your perspective and how you deal with it?
Yes, so it definitely has made a huge impact. I think people who are survivors themselves, whether they've lost someone or gone through those suicidal ideations, they're willing to share their story now. They're willing to share those personal and those lived experiences, which also helps, you know, making it more, busting those stigmas, if you say so. Yes.
We talk about adults and suicide. What about children's suicide? We only have about 30 seconds left, so I'm sorry, it's got to be brief with this, but do children verbalize like adults do when they're thinking about these suicidal thoughts?
Theirs is going to be a little different. Theirs, because bullying kind of starts that little pathway.
And sometimes you don't know about it.
Sometimes you don't, because sometimes kids will not tell you. Sometimes they'll keep it to themselves. So if you start to notice that, that might be that warning sign or clue to kind of lead you into maybe asking some more questions.
Hopefully some nice tips here as we're in Suicide Prevention Awareness Month. Shakara, thanks so much for coming in today.
You're welcome.
Enjoyed
Thank
it.
you.